as well as the public who may be following this via YouTube and streaming. Thank you for joining the Education, Health, and Environmental Affairs Committee today, January 20th. We have, I believe, 10 bills. Most of them are by request from different agencies, and many fall under the category of sunset, extension, or reviews. Unless conditions change, we will go in ascending order. And with that, many of these, the lead witnesses come from, in fact, those agencies. Let me just remind those people following, some committee members may be joining us and then having to leave to testify in front of other committees. With that, we'll start with Senate Bill 168, Department of Health, Immunet and Statewide Advisory Commission on Immunizations. And I believe we start with Ms. Heather Scheck from the department.
Thank you, Chair Pinsky. Good afternoon to the Chair, Vice Chair Kagan, committee members. Thank you very much for the opportunity to testify in support of Senate Bill 168. As the Chair stated, this is a bill proposed by the Maryland Department of Health. My name's Heather Scheck. I'm the Director of Governmental Affairs at the department. And so Senate Bill 168 does two important things. The first is that it will remove a carve-out in the existing law that exempts healthcare providers who administer vaccines in nursing homes, assisted living programs, continuing care retirement communities, or medical daycare programs from reporting to Immunet. So right now, the facilities that I just mentioned are not required to report to Immunet under normal circumstances. During the COVID-19 pandemic, they were required to report. And so the department feels that this has shown that these facilities have the capacity and the capability to provide this data on an ongoing basis to the Immunet platform. These healthcare professionals are providing care to some of Maryland's most vulnerable residents, and the data provided to the Immunet platform by those providers it has really been invaluable in the fight against COVID-19. And so the department is requesting that the continued reporting be put into statute. And then the second thing that the bill does is modify the members of the Statewide Advisory Commission on Immunizations, and it institutes term limits of 4 years for several of the seats on the commission. The department is in full support of Senate Bill 168, and as such, we request that the committee return a favorable report. With that, I will keep it short and sweet and stop there, and I'm happy to take any questions the committee has. Thank you.
Okay, we have one more proponent. Let's hold questions. We have one proponent and one opponent. Scott Tiffin is favorable with amendments. Mr. Tiffin.
Thank you, Mr. Chair and members of the committee. My name is Scott Tiffin. I'm here on behalf of the Maryland Nursing Association and the Maryland Assembly on School-Based Healthcare. As Heather already said, Immunet is a vital tool that's been super important to the state during this pandemic. We just have one small minor amendment that we hope the committee would consider, and that's to add a school nurse to the advisory committee, and then also add a school-based healthcare provider to the advisory committee. Our schools have been a very important and in some ways underutilized part of our vaccine plan. We just think the voices of our school providers could really be an asset to the committee and to the entire state. So happy to answer any questions if you have any.
Okay, are there any questions for Ms. Scheck or Mr. Tiffin, who are both proponents with one variation, which we'll take up when we take up the bill? Senator Ellis.
Okay. Yeah, thank you, Mr. Chairman. Thank you for this bill. I have a question. So, Immunet, is that like a registry of all vaccines administered to our citizens?
Yeah, so Senator, any vaccine.
Just explain just explain briefly what Immunet is and how it works.
Sure. So any healthcare provider in the state that that administers a vaccine is required to report that vaccine administration into Immunet. And it's to your point, Senator, it's a database of vaccinations for Marylanders.
Yeah, so no matter where they go, whether it's CVS or Giant Pharmacy, Safeway Pharmacy, or their primary care provider, that vaccination that's given there is in that database?
Correct.
Okay, great. Thank you.
You're welcome.
Seeing no questions, we have one opponent. We will go to Vincent McAvoy. Is he with us?
Yes, thank you, Senator. Can you hear me all right?
Yes.
Great, thank you so much, and welcome to term. My concerns with this bill have to do with the construction, where we are removing those who are we're making people who are having without term limits. And I'm concerned about this being more of a political animal. We have seen in recent years where this issue has become very political. Another issue that I see is that this is going to be taking effect in July 3rd. I don't know that, I'm wondering what the emergency is there, actually. And then we also see that the people who are being made to enter again, they are getting a longer term of 4 years, that they are the medical people. These are people who may be bringing independent voices, and I think that's very important to what we're dealing with here. And I see that we have a consumer on the list, and I'm just not quite sure what that would entail and how we're determining. A last issue is that is this something in the way of packing the committee, where we say that we can recommend 3 additional people as needed? I think I think all of these are issues, and I would like to see that the final construct, I understand you're still working on it, is something less political and more focused in uncensored, open dialogue science. Thank you all for your time.
Thank you, Mr. McAvoy. Your sign up in opposition. If you think there are ways to improve the bill and still think it's worth it, please forward them as soon as possible.
I will. Thank you. I appreciate
okay.
that, Senator.
Okay. Seeing no questions, that concludes the bill on 168. We will move to Senate Bill 182. This is State Board of Electricians sunset extension. And I believe we will start Robin Bailey. Welcome, Miss Bailey. It's been a while. Is she with us?
I don't think she's with us yet, Senator Penske. I haven't seen her.
Well, we'll skip Labor Department. They have the next 2 bills. So then we'll go to, we'll go to 186.
Okay, good.
Drug Assistance Program rebates. And we will start with Peter DiMartino from the department. Lamar, could you text Robin and see if she's get with us soon? Okay.
Number for her, I'll email her.
Okay, Mr. DiMartino.
I see she's logged in now. She just came in.
Okay, we'll still stay with Mr. DiMartino, who will be followed by Ms. Scheck. Mr. DiMartino.
Hello, my name is Peter DiMartino, and I currently serve as the director of the Infectious Disease Prevention and Health Services Bureau. We're Maryland's response to sexually transmitted diseases, including HIV and viral hepatitis. And we're also the proud home of one of only 3 state-level units devoted to drug user health and harm reduction services in the nation. I'm here today to provide testimony regarding SB 186, Maryland AIDS Drug Assistance Program rebates. If passed, this will bring Maryland into compliance with HRSA regulations, which is devoted to maximizing revenue to the program prior to requesting federal funds. In addition, this establishes a fund for MADAP The Maryland AIDS Drug Assistance Program actually predates the practice of establishing funds and has never had a special non-lapsing fund, although we've operated as though we have. And this bill corrects that oversight. The legislation will have no impact on the department, which houses MADAP, as the transfer of funding from general funds to a special non-lapsing fund will signify no monetary loss or gain. And with that, I am available for questions.
Thank you. Let's go to Ms. Scheck, and then we'll take any questions of authority. Ms. Scheck.
Thank you, Chair. Good afternoon again. For the record, Heather Scheck on behalf of Maryland Department of Health. As you just heard from Dr. DiMartino, Senate Bill 186 seeks to bring Maryland into compliance with Federal Health Resources and Services Administration, or HRSA, regulations regarding maximizing revenue to the program prior to requesting federal funds. And I guess to back up a little bit, to give a little background on what the Maryland AIDS Drug Assistance Program, or MADAP, is. This program ensures that people living with HIV or AIDS in Maryland have access to the medication they need to stay as healthy as possible. The program pays for medications for eligible clients that either don't have insurance, or it helps clients who do have insurance by paying for eligible copays and deductible costs so that they're able to get their medication. The program currently serves on average 5,900 clients each month, and enrollees can use the program to receive their medications at any of the approximately 1,600 Maryland pharmacies that accept Medicaid. So just a little background on what the program actually does. And as Dr. DiMartino said, the amendment to Senate Bill 186 really is to bring Maryland into compliance with federal regulations. The regulations state that to the extent available, non-federal entities must disperse funds available from program income, including, among other things, interest earned, before requesting additional cash payments. And this issue was brought to our attention during an August 2020 OLA review of the department's pharmacy services, and it revealed that the MADAP program was not receiving the interest earned on the rebate funds. So, as Dr. DiMartino said, we're seeking to correct this by allowing drug rebates to be held in interest-bearing accounts, and for the interest accrued from those accounts to be transferred into a special non-lapsing fund. Additionally, the department is offering an amendment based on feedback that we received from the state treasurer's office. The amendment just seeks to establish in statute that special non-lapsing fund where the interest accrued will be held. As Dr. DiMartino said, the program predates the practice of establishing funds like that. And so MADAP didn't have one, even though they operated as if they did. So Senate Bill 186 corrects this and provides statutory consistency with this fund and other special funds in Maryland.
Thank you.
With that, I will stop there. Again, thank you for the opportunity to testify, and we would respectfully request the committee return a favorable report. Thank you.
Thank you. Questions for Mr. DiMartino or Ms. Scheck? Seeing none. I will say MADAP is a terrific program. Besides the technical corrections now, it saves a lot of lives, and it's been very important. Even when people's insurance have run out in the early days, it would continue that insurance rather than have those people lose their benefits and not be able to afford the drug. So I've been working on this bill a lot of years. Seeing no further questions, that concludes the hearing on 186. Thank you both. We'll go back to the Department of Labor. Ms. Bailey, who I started to say a long time, formerly an employee with Senator Pinsky many years ago on my staff. Ms. Bailey, welcome. We're dealing with 182 Board of Electricians Sunset Extension. Ms. Bailey.
Chairman Pinsky, this is Greg Morgan. I'm the Commissioner of the Division of Occupational and Professional Licensing,
Oh, okay.
and I will be presenting today.
Okay.
Great, thanks.
Please proceed.
Good
Mr.
afternoon,
Morgan.
Chairman Pinsky. I'm sorry.
Please proceed.
Sure, thank you. Good afternoon, Chairman Pinsky and Madam Vice Chair Kagan and esteemed members of this committee. I am Greg Morgan. I serve the citizens of Maryland as Commissioner of the Division of Occupational and Professional Licensing at the Maryland Department of Labor. I'm here today representing Secretary of Labor Tiffany Robinson, who sends her kind regards to this committee. Our division oversees the licensing and regulatory compliance of 254,469 licensees in 24 occupational and professional licensing categories, with oversight provided by 21 appointed boards and commissions. Joining me today is Robin Bailey, who is Executive Director of the State Board of Electricians. So when we're done, Director Bailey is available for questions. I'm here today to ask this committee for a favorable report for Senate Bill 182, which is a sunset extension of the State Board of Electricians. The board licenses and regulates 5,927 individuals who provide electrical services pursuant to the provisions of Business, Occupations, and Professions article established for this board. The board remains committed to accomplishing its objective of ensuring industry compliance with Maryland law, as well as local building codes and permit requirements for the electrical services industry, and generally promoting a safe and sound electrical services industry in Maryland. The board continuously works with industry organizations and members of the state legislature to improve and simplify the path to licensure while maintaining the integrity of the licensing standards set forth by the statute and corresponding regulations. For these reasons, the department respectfully requests a favorable report from this committee on Senate Bill 182.
Thank you. Questions for Mr. Morgan? Questions for Mr. Morgan? Seeing none, thank you. Well, we have a second bill with the same two people. So that concludes the hearing. There's no opposition to 182. That hearing is closed. Now we'll move to 184, Board of Heating, Ventilation, Air Conditioning, and Refrigeration Contractors. Again, a sunset extension. Mr. Morgan.
Good afternoon, Chairman Pinsky and Madam Vice Chair Kagan and esteemed members of this committee. I am Greg Morgan. I serve the citizens of Maryland as Commissioner of the Division of Occupational and Professional Licensing at the Maryland Department of Labor. I'm here today representing Secretary of Labor Tiffany Robinson, who sends her kind regards to this committee. Our division oversees the licensing and regulatory compliance of over 254,000 licensees in 24 occupational and professional licensing categories, with oversight provided by 21 appointed boards and commissions. Joining me today is Robin Bailey, who serves as Executive Director of the State Board of Heating, Ventilation, Air Conditioning, and Refrigeration Contractors. We are here today to ask this committee for a favorable report for Senate Bill 182, which is the sunset extension of the State Board of Heating, Ventilation, Air Conditioning, and Refrigeration Contractors. The board licenses and regulates 19,768 individuals who provide HVACR services pursuant to the provisions of Business, Occupations, and Professions articles established for the board. This board remains committed to accomplishing its objective of ensuring industry compliance with Maryland law, as well as local building codes and permit requirements for the HVACR services industry. And we work hard to promote a safe and sound
You're buffering on us, Mr. Morgan.
Industry. And I'm sorry?
You were buffering on us for about 30 or 45 seconds.
Okay. All right, is it good now?
Yes.
Okay, great. And we continually work hard with industry organizations, members of the state legislature to improve and simplify the
You're buffering again.
licensure while maintaining the integrity of licensing. Actually,
You're okay now.
I apologize. We're having connectivity issues today. That's why I was delayed in getting on. So we might have some hiccups, but hopefully clear now. We respectfully request a favorable report for Senate Bill 184. Now I'll open it up to questions.
Okay, Ms. Fryhester, Senator Fryhester.
Thank you, Mr. Chair. And thank you for bringing these two important bills forward. My question was whether when we do a sunset extension, is there a report that's done, prior to that? And did we receive the report? Or is that not a thing?
It's we sent in a letter of support, but I'm not aware of a report required. But if there was one, we certainly would have sent it. But I'm not familiar with that, but I can look into it.
I just want to make sure I wasn't missing something.
I believe we can ask committee counsel. Sometimes there's a full review.
Right.
The recommendation. Sometimes the date expires and it just needs an extension. I'm not sure a full review is done every time there's an extension. Committee counsel can answer that possibly.
So if there's a record, Senator Hester, I can obtain it through the library. I think that this was the year to do the program evaluation act. So I can check in with the library and make sure that's distributed.
That would be great for both this bill and the previous one. Thank you.
Sure.
And actually there are a few more. I spoke out of turn. We have 2 or 3 more from the Labor Department. But we will check to see if there are any other reports that go along with these.
Thank you so much.
Thank you for bringing that to our attention, Senator Fryhester. Okay, let's go. Ms. Scheck, you're going to have to hold on a little bit. I should have kept all of your bills together. I didn't, so we'll stay with labor and then we'll come back to you. 193, sunset extension on plumbing. We're going from one field of work to another. This is 193. Mr. Morgan, you don't have to do the introduction about how many boards and commissions and how many people. You've mentioned that twice. So if you want to skip the first couple paragraphs, we're good with that.
Okay. Make sure just want to make sure I wasn't muted. Sorry. So again, Chairman Pinsky and Madam Chair Kagan and esteemed members of this committee, thank you for allowing the Division of Occupational and Professional Licensing to present today. Joining me today is Robin Bailey, who is Executive Director of the State Board of Plumbing. I'm here, we're here today to the sunset extension of the State Board of Plumbing. And this particular board license and regulates 12,696 individuals who provide electrical services pursuant to the provisions of Business, Occupations, and Professions article established for this board. The board remains committed to accomplishing our objective of ensuring industry compliance within Maryland law, as well as local building codes and permit requirements for the plumbing industry, and generally promoting a safe and sound plumbing industry in Maryland. The board works hard with industry organizations and members of the legislature, as well as local officials, municipalities and counties, to make sure that we create a smooth and simple path to licensure, but we always want to maintain the integrity of the licensing standards set forth by the statute and corresponding regulations. In the building services industry, it's very important that licensing and regulatory compliance is in existence to, to protect the citizens of Maryland. And so for the reasons, the department respectfully requests a favorable report from the committee on Senate Bill 182. And I'll open it up to any questions.
Okay, questions for Mr. Morgan on the plumbing board, 193. Seeing none and there not being any opposition, we will move on to 199, architects, sunset extension. Again, Mr. Morgan. You look to be frozen. I would suggest you contact Do It, but there are a few problems with Do It at the moment as well, and confidence. We can come back to you. Let's do that. Let's shift to Ms. Scheck. You're coming back sooner than I expected. Let's go to 195. State Board of Examiners of Psychologists, Sunset Extension. Ms. Scheck or Lorraine Smith, I don't know who's taking the lead on that.
I can go briefly, Chair. Thank you.
That's fine.
Again, good afternoon, Chair, Vice Chair, and committee members. For the record, Heather Scheck, Director of Governmental Affairs at the Department of Health. I'm here today to testify in support of Senate Bill 195. This is a sunset bill and a departmental that extends the Board of Psychology, their statutory and regulatory authority for 10 more years, or so until July 1 of 2033. There have been no reported issues with the board, and there are no outstanding deficiencies. The most recent sunset evaluation report from DLS was done in 2011. And again, there were no deficiencies cited. So I'd be happy to provide the committee a copy of that report if necessary. So in closing, the department supports this bill and requests the committee return a favorable report. Thank you.
Thank you. Ms. Smith.
Good afternoon. Thank you for allowing me this opportunity to speak. My name is Lorraine Smith, and I'm the Executive Director of the Psychology Board, and the board supports this bill. As you know, with the pandemic, and if we ever get beyond this pandemic, having qualified psychologists is essential to provide quality mental health services. So with that said, the board strongly supports this bill, and the board asks that you vote in favor of continuing the Psychology Board.
Thank
and
you.
I'm here to answer any questions.
Okay, we have one more proponent, Ms. McGee. Let's hear from her, then we'll take any questions. Welcome, Ms. McGee.
Good afternoon. For the record, I'm Linda Fleming McGee. I'm president of the Maryland Psychological Association. MPA represents 1,000 doctoral level psychologists throughout the state, and we would like to offer our strong support in favor of Senate Bill 195, State Board of Examiners of Psychologists Sunset Extension. SB 195 continues the statutory and regulatory authority of the State Board of Examiners of Psychologists. The Board of Examiners provides critical role in ensuring the well-being of the citizens of Maryland and the oversight of the profession of psychology. So in that regard, we MPA ask for a favorable report on Senate Bill 195. Thank you, and I'd be happy to take any questions.
Okay, a quick question, Ms. Scheck. You said a reviewer report, I can't remember how you described it, was done in 2011. Is another one required or expected in 21 or 22, or when is the next one scheduled?
So forgive me, I can't remember the exact year, but sunset evaluation report reviews are only done by request now. So it used to be done periodically on a regular cadence. And I apologize, I can't remember the exact year that changed, but now they're only done by request. And so as far as I know, there is not another one scheduled in the near future for this board. Okay,
seeing no questions, that concludes the hearing. We're going to keep, hopefully Mr. Morgan's back in track, but we're going to stay with the Department of Health. Let's go to 202, optometry. And we have Ms. Bennett and Ms. Scheck. Once again, whoever wants to lead off can do that.
Thank you, Chair. I'll lead off, and I think I'll just say ditto to my last testimony. For the record, Heather Scheck, Maryland Department of Health. Senate Bill 202 is another sunset bill and departmental, and this one extends the Board of Examiners in Optometry, their statutory and regulatory authority for 10 years, 10 more years, July 1, 2033. Again, The most recent evaluation report from DLS was in 2011. There were no reported issues. There are no outstanding deficiencies. And so the department supports this sunset bill extension and requests a favorable report. Thank you.
Thank you. Is Ms. Bennett with us or not? And Ms.
Yes, I'm here. Yes, I would just like to add that for more than 2 decades, I have shepherded and guided the board through its numerous fiscal, operational, legislative, regulatory mazes. And I can say that the board members as individuals and the board takes its role seriously to protect the public. And it's been my honor to serve the citizens and the board. And I will mention that I will be retiring as of March 1, 2022. And I've seen and worked with you all over the years, over these 2 decades. And I'm glad to leave the board in a good position. And hopefully they will continue as they are the primary eye care practitioners in the state. Thank you.
First of all, thank you for serving our state for those years. Ms. Bennett, thank you very much. And we wish you well in hopefully having more time to you and your family. And thank you again.
Thank you.
Concludes the hearing on that legislation. I will be shifting it over to the Vice Chair, Senator Kagan. With that, Senator Kagan, it's all yours.
Thank you very much, Mr. Chair. Ms. Bennett, again, I will add our very best wishes to you in retirement. Were there any questions or comments for Ms. Bennett? Okay, so that bill the hearing is complete. Thank you very much. We are going to Senate Bill 209, State Board of Physical Therapy Examiners, and this is another sunset extension. And I just see that Lori Kendall Ellis just joined us. Welcome. We also will have Heather Scheck again. Ms. Kendall Ellis, welcome to EHE.
Thank you very much. And I am very appreciative. My name is Lori Kendall Ellis. I'm the Executive Director for the State Board of Physical Therapy Examiners. I'm really delighted to be here. This is my first time, unlike Ms. Bennett. So thank you again for your time and for listening as our board feels very strongly and is very supportive of Senate Bill 209. Which will extend the board's statutory and regulatory authority for 10 years. We take our mandate very seriously and work very diligently to support our mission, which is to protect the health, safety, and welfare of all Marylanders through the promotion and oversight of the physical therapy practice. I respectfully request a favorable outcome of this bill, and thank you again for considering my testimony.
Thank you, Ms. Kendall Ellis, and Heather Scheck, back to you.
Thank you, Vice Chair Kagan. I'm going to say a third ditto. Heather Scheck with the Department of Health. And again, as Chair stated and as Vice Chair stated, this is another sunset bill, another departmental, and it extends the board's statutory regulatory authority for 10 years until July 1, 2033. Same as the other 2 boards, the last sunset review was done in 2011 and there were no reported issues, no outstanding deficiencies. So we would just respectfully request that the board's authority is extended, and we fully support that. Thank you.
Thank you, Ms. Scheck. Appreciate it. Colleagues, are there any questions for either of our witnesses? Seeing no hands, that completes the hearing for Senate Bill 209. Thank you both. The next bill, we're going to try to go back and see if the architects are building a presence in the Zoom room. Senate Bill 199. Thank you, Heather. I appreciate people who get bad puns. This is the State Board of Architects, another sunset extension. We will have Mr. Morgan, hopefully, who's able to have good Wi-Fi this time. Welcome, Mr. Morgan.
Madam Vice Chair Kagan, thank you. And I appreciate everyone's patience today. Again, we are relocating our offices, and there's a lot of wiring and Wi-Fi work being done today. So I apologize for that, but I went old school and we are connecting through the Wi-Fi on my mobile device.
There you
And just
go.
real quick, were there any questions on Senate Bill 193? That's when I lost the connection.
I don't believe there were any. I think we're good.
All right, very good. So again, for the record, I'm Greg Morgan. I am the Commissioner of the Division of Occupational and Professional Licensing in the Maryland Department of Labor. We are here today to ask this committee for a favorable report for Senate Bill 193, which is the sunset extension for the State Board of Architects. The State Board of Architects license and regulates 7,620 individuals who provide architectural services pursuant to the provisions of business occupations and professional articles established for this board. The board remains committed to accomplishing the objective of ensuring industry compliance with Maryland law, as well as local building codes and permit requirements for the architectural services, and generally promoting a safe and sound residential and commercial construction industry. The board continuously works with industry organizations, members of the state legislature, as well as local jurisdictions to improve and simplify the pathway to licensure while always maintaining the integrity of licensing standards set forth by the statute and the corresponding regulations. For these reasons, the department respectfully requests a favorable report from the committee on Senate Bill 193, which would be a 10-year sunset extension. At this point, I'll ask if there's any questions.
Thank you, Mr. Morgan. Colleagues, I want to note that the American Institute of Architects has submitted written testimony endorsing this bill. Are there questions from colleagues? If not, I have a quick one. I see no questions from colleagues. Mr. Morgan, several years ago, I had a constituent who was scammed, who had his architect's license used by someone who used to work for him and was able to get business and construct decks that could fall apart and endanger people's health and lives, actually. The Department of Labor and the Board of Architects was medium responsive, I think is the way I will characterize it. So I just want to talk about that case again, because these boards, we sometimes just plow through these really quickly, but some of the work that these boards do literally can be life or death, as well as people's well-being as professionals and their reputations and businesses. So I just want to bring up that case again, because that was a long time in being addressed. So
Madam Chair, if I could respond for a minute.
Please do.
So I come to the Department of Labor after a 33-year career in the construction industry. And so I come with the background in construction and working with the architecture and engineering industry. And I can assure you that our boards and commissions are focused on the mission of protecting the citizens of the great state of Maryland. In fact, on the corner of my desk, I have both the mission of O&P and the customer service promise for the state of Maryland. So the past experience certainly is not reflecting the mission of today. The Board of Architects is a good group, and as in all of our boards and commissions, they're a balance of consumer advocates as well as industry representatives.
Thank you.
And I implore anybody in any of the committees that if you ever have an issue, please reach out to me directly. We take our job very seriously.
Okay, I think you designed a good answer there. So with that, if there are no other questions or comments, that completes the hearing on Senate Bill 199 for the architects. And also, Mr. Morgan, you mentioned LMP, I think was the acronym you used. Can you just define that for us, please? You're muted.
I'm sorry, it's occupational professional licensing, and we go by ONP. Yeah,
Okay.
so
I didn't even hear it right when I know what it meant.
My year and a half in state government, I've learned a lot of acronyms.
Yes, we try to avoid acronyms here where we can, but anyway, okay, that completes the hearing. Thank you. Our final bill for the day, colleagues, is Senate Bill 211, which is an important phone number to remember, and it is an important bill, I'm sure. It is the State Board of Professional Engineers, and it is another sunset extension, and that will complete our hearing for the day after we hear from Mr. Morgan again.
All right, 5 is the charm today. Madam Vice Chair Kagan and members of this committee, again, for the record, I'm Greg Morgan, and I serve the citizens of Maryland as a commissioner of the Division of Occupational Professional Licensing at the Maryland Department of Labor. And I'm here today representing Secretary of Labor Tiffany Robinson, who sends her kind regards to this committee. I'm here today to ask this committee for a favorable report. I'm sorry, I struggle with that, for Senate Bill 211, which is a sunset extension of the State Board of Architects. The board licenses and regulates 31,486 individuals who provide professional engineering services to the provisions of the Business, Occupations, and Professionals article established for this board. And the state professional engineers who provide it's structural engineers, electrical engineers, mechanical engineers, civil engineering. So it's a broad base of engineering. We remain committed to accomplishing the objective of ensuring industry compliance within Maryland law, as well as local building codes for the professional engineering services. And it's about promoting a safe and sound construction industry for both the residential and commercial construction industry. We work continuously with industry organizations and members of the legislature to improve the path to licensure while always maintaining the integrity of the licensing standards set forth. For that, I ask that this board vote in favor, provide a favorable report from the committee on Senate Bill 211. And now again, if there's any questions.
Thank you, Mr. Morgan. Senator Simonaire, do you have anything you want to talk about as a professional engineer?
Actually, I was listening.
No, I'm sure you were.
No, I'm good.
Okay, you're good. But Senator Ellis is not. He has a question. Please, Senator Ellis.
I'm still good with a question. Madam
You're all
Vice Chair.
there.
Thank you so much. Up to I think Mr. Morgan. Thank you for your testimony. Question about professional engineers. So how many did you say are in Maryland, professional engineers?
Let me put that up. So it's the total number is 31,486.
31,000. And I know there are various categories of professional engineers acquiring their licenses, right? Are you familiar with those different pathway to full PE licensure? You can go.
It's done through each of the particular categories, and I'm not intensely familiar with it, but I can certainly, if you have a specific question or for a specific, whether it's structural or electrical or mechanical, I can certainly find out.
Yeah. So just the professional engineers, there are various categories of engineers. Categories to attain licensure through college degree after X number of years, or individuals can go into the kind of like an apprenticeship program directly out of high school, and they take the maximum of years to get licensure after testing and stuff like that. I'm always curious about how each of those pathways work and how many PEs are produced from each of those pathways. A couple of years ago, Secretary Robinson came before a committee, and I couldn't get the answers then, and I still don't have the answers. And I'm kind of person, I never get the answers. They always stay in my brain, and I'm going to get the answers eventually. It could be 2 years, 3 years, or maybe 10 years. I don't know. But if you could check that out for me, maybe you have better access to data, can get that back to me at a later time.
Absolutely, Senator Ellis. I made a note, and we recorded your questions, and we will get those answers to you for sure.
Thank you so much, sir. I appreciate it.
Thank you, Senator Ellis. Thank you, Mr. Morgan. I see no other questions from senators. Seeing that completes the hearing on Senate Bill 211 on professional engineers, sunset extension. With that, colleagues, I just have one quick announcement. The chairman asked me to make sure that you all know that while we'll often vote on Fridays, we will not be voting tomorrow. So no voting session at all. We will reconvene this committee on Tuesday. And with that, have a great weekend.